So here's a joint, a knee. This is a normal one, nice big fat cartilage in there. And then this one has a thin amount of cartilage. So as long as there's cartilage in there, we can put stem cells in there. They replicate so we put a few million into a knee joint, they replicate into millions and millions. After they replicate, they become whatever you want them to be. So, cartilage. We're going to educate you on how to eat, what to eat, and regenerative care on stem cells, exosomes. So, and really, there's no reason you can't be healthy with all this stuff we're going to talk about today. So no matter what, I mean, we see people with psoriasis and rheumatoid and all kinds of stuff. And one of my rheumatoid patients who's 84, full-blown rheumatoid coming in 6 years ago, 5 years ago, something like that, a long time ago. And some of you know her. And she comes in, she looks so young, and she rides horses every day. And she's pretty much out of 98% of her pain, maybe 100% most days. And she is full-blown, autoimmune disorders, rheumatoid. So these people get better if you treat them properly. I wrote a book called This Is Why Your Back Hurts, with a whole chapter on nutrition. Learned a lot more since I wrote the book too. So I've been studying nutrition, I was telling you, for 50 years now, since I was in grade 9. We had the only biochemistry and microbiology in whole North America. So we were growing diseases and all kinds of stuff in grade 10, 9 and 10. So and then biochemistry after that. I took I got a degree in biochemistry, taught biochemistry, then became a chiropractor, and been learning ever since, a naturopath, and continued training in nutrition and all that. So that's my background. So pretty much 50 years of learning this stuff. So I've seen the changes. So that's me, Dr. Von Dabbs. I have an orthopedic chiropractic degree, and naturopath. And I just told you what happened to me and why I became a patient. And so that's how I really learned the power of nutrition. Because at 49, I guess at the time, I was invincible. I thought I was. At 45, I was invincible, and by 50, I was having 5 years of pain. So didn't realize that food did that to me. So switched the diet, and I've been fine ever since. So I've been practicing for 37 years. So, and with our team, we have a team here. It's not just me. People think it's me, and it is mostly me. But we have 3 chiropractors, 3 PTs. We have a nurse practitioner, naturopathic doctors. We have a team for biogenetics that comes in. So when a patient signs up for functional medicine with us for a year, we fix them up, and then we blood test them, and we figure out what else is not in the green zone of lab tests. And they come in with their think tank, a bunch of PhDs, some MDs, chiropractors, nutritional NDs kind of thing. And they have a whole team. They do circles around me with biochemistry, even though I know biochemistry. I'm blown away what they know. And they don't see patients. All they do is they monitor our patients, and they just tell us what to do. And so but we get that on tough cases, we bring them in. So otherwise, usually I can fix them on my own, but I bring them in when I need to. And we have MDs we consult with and stuff like that, because we usually consult with your medical doctor if you're part of it, if they want to. Sometimes they don't want to take you off the medication, so we have to go another route. They will yell at my patients, "You do not go off that statin." And they make them cry. It's like crazy. They just do not understand nutrition and the body's and real health. But you have a heart attack, they'll still they'll save you. You break your arm, they'll save you. They're very, very good at urgent care. Chronic care, not so much. Yeah. So this is the kind of stuff that we've done in the past and currently do medical services, which is stem cells, exosomes with our nurse practitioners, some weight loss, functional medicine, chiropractic, physical therapy, and a whole lot more. So what's the difference between medicine and conventional medicine, functional medicine and conventional? So they're disease-orientated. So by the time you got the full-blown autoimmune disorder, they'll put you on a steroid. That's how they fix it. It doesn't fix the cause, they just fix the symptom. It's doctor-centered, so you go to a doctor. So this is where it comes into where doctors are compartmentalized or specialized. So these two are going to go together. So you're losing your toe because the blood supply is not there, and it gets infected, so you lose it. And then another patient comes in, and so they see a surgeon for the toe. And you have a hardening of the arteries, a heart problem, and so you see cardiologist, right? You got Alzheimer's, and so you see the the gerontologist. Well, it's all the same disease. It's all from sugar and eating bad. Sugar. So if they all got together and said, let's fix this person's diet, they wouldn't lose their toe from diabetes. They wouldn't lose their heart problem because they eat so much sugar. But they now have them on all kinds of medications for each one of these things without treating the cause. So, and believe me, sometimes we need medicine. So when you have Crohn's disease, we treat that. But I need to put the fire out, because they're on fire in their gut and diarrhea every day, and they're not getting any nutrition. So we will get them to the doctor to put them on steroids for 60, 90 days, and then we'll work on their diet after that. And we actually put them on a carnivore diet sometimes for 30 days. Then we switch it to vegetarian diet for 30 days, and then we'll switch it to more of a Mediterranean diet, and then they're safe. So, and we fix it. It's not as simple as you think, because it's pretty complex, the body, but we've got it down now for pretty much all autoimmune disorders, and heart disease is pretty simple. So people don't realize you just eat an alkaline diet. If you're on they took a bunch of patients on triple bypasses. They're on our fourth one. This is a medical study. They're on our fourth triple bypass. And they said, no, we're not doing another triple bypass. We're going to put you on an alkaline diet, which is fruits and vegetables only. Lots of green lettuce and stuff like that. Sure enough, all of them reversed. They're no longer hardening of the arteries. They inject the dye into the bloodstream, it's all opened up again. And it was only 6 months, 2 years they reversed and never needed anything. Wow. That's hard. That's how easy it is to fix. But they want to do surgery, cut you open, and all that stuff. So that's the kind of stuff we know. And the alkaline diet is not just that stuff, it's everything. Every disease in the world gets fixed with an alkaline diet, up to a point. If you're too far gone, maybe not, but it takes a lot to not reverse. This diagnosis is based on symptoms. So you have a headache, take an aspirin, but what's causing the headache, right? We don't go by symptoms. We go by symptoms, and then we look for the cause. Early detection of the disease is what they do. So whereas functional medicine is health-orientated, so they try to keep you healthy or make you healthy. So patients, and they do that, it's patient-centered, so we spend a lot more time. So MDs, they're on a schedule of 5 minutes, right? Because insurance companies cut them down so much. I mean, I feel sorry for them. They're cut down so much by United Healthcare and Cigna. They're just not getting paid anything, so they got to rush through it really quickly. So it's not their fault, it's just the way insurance works. So they're not spending time with you, so that's where the problem is. So we in functional medicine do spend time with you. We sit with you for many, many hours basically and get to know your health and start different protocols all the way to get rid of certain things. And it is complicated, so we start all these protocols, and then it gets simpler, simpler, and simpler, and then very few things show up, and then it gets really simple. So that's how we fix it. So we look for the underlying cause of disease. All right, so you got a statin, a high cholesterol. All right, how many people are on statins here?
They're trying to give them to me. I'm
not so high cholesterol. So you have to ask the question, why is your cholesterol high? Did they ask you? Mm-mm. Did they find the reason? No, they're not going to. They're just going to put you on a statin. So we look for why is your cholesterol high? Cholesterol, 200 functions. This is just a very small part of it. 200 functions in the body. So you wonder why testosterone gets lower? Because you're on a statin. Cholesterol turns into testosterone, turns into cortisone. So you don't have cholesterol, you're going to be swollen. No cortisone. So it has so many functions, so there's a reason why it's high. So you got to figure out why is it high. And mostly it's from the liver, it's toxic. So what makes the liver toxic? More and more toxic. A statin does, and so does all the processed foods. So does all the other medications you're on. They all make the liver toxic, and your cholesterol is going to go up because it's got to make repairs. So if you have low cholesterol, you're not repairing your cells at all because you need cholesterol to repair every single cell in your body. So the cell walls are made of cholesterol and other lipids. So if you don't have it in your body, those cells aren't repairing and you're just going to slowly destructive. So they don't take this consideration. I'm a biochemist, so I could follow a lot of this stuff, right? And then biogenetics, who comes in, who we team up with, they know, they go way more integral than I do. So they know all this stuff, but your MD doesn't know this at all. So they just know high cholesterol, statin. That's the only direction they go. So if we fail, take a statin, but basically we usually don't fail. And if you got high cholesterol for a year, no big deal. It takes 20 years of high cholesterol to cause a problem, maybe 50 years, maybe never. So People who had high LDLs, they used to say you need a statin. Now they're saying no, doesn't mean that at all. Doesn't mean it at all. HDLs, if it's low, does that mean you got a cholesterol issue? No. So they've changed it all now. Oreo cookie treatment lowers LDL cholesterol when you have a ketogenic diet. Go figure that one. So you're eating all meat and you got high lipids, cholesterol, and you eat an Oreo cookie and it goes down. Better than a statin does.
Oh my God.
Why does that happen? I have a clue. But there's a study right there. So, I mean, this is just an example of like, what?
Is this something we're laughing at here?
What's that? No, this is real. This is a PubMed real study.
Real deal.
When you read a study, 90% of the studies are forged or faked. So basically, what we treat when we see patients, we do our evidence-based research and not the fake research. And I have the clinical practice, and we join up with other clinical practice to learn a lot more, and then we have the patient giving their story, and we have optimal outcomes. So, and in here is also their MD, so we can work with the MD if they allow it. We're basically coaches for you for diet and exercise. So we usually, people sign up for a year, we just have to sit them down every 2 weeks and go over different levels of coaching and diet, exercise, sleep, things like that. And hopefully they'll listen to me and do it. And but even if they don't, I'd say about 9% don't do everything I tell them to do, but they're about 9% get super healthy. About 100% get better, but 90% get like fixed. You know, I had a patient came in with psoriasis, didn't tell me, just wanted to get healthy, and 60 days later he goes, I feel the same, and I go, well, you don't have any complaints to begin with, and he didn't tell me it's psoriasis. He goes, oh, but my psoriasis cleared up. I go, psoriasis? What are you talking about? You had psoriasis? And just by detoxing him and cleaning his gut out and cleaning out parasites, it cleared it up. But we've already done that on him. So, and we do alternate treatments which are safe. Like I'm not on any medications. So my blood test shows, and I could show anybody if they want to see it. Cholesterol is super low, but it's normal. It's on the low. Lipids super low, liver enzymes super low, but they're all normal. So everything is in a normal range, green zone, but it's perfect level. So, and of course, biogenetics picks it apart and says you got this issue a little bit, so we have to repair that. But it's pretty much I'm normal. It's just they like it right in the middle of the bell curve. So, and it used to be high cholesterol, high lipids, high liver enzymes, high all that stuff. It was terrible back a decade ago, and so I've been working on it for years and got it way down. So everything's fixed. But it only took 90 days to get me healthy the first time of doing it and continuing on. And then I start doing more stuff as we go along, just based off research, and it works. Foods to eat, I like fruits and vegetables, all fruits and vegetables, mostly fruits, all right? Fruits are probably one of the best things to eat. What has more sugar in it, a potato, white potato, or let's say an apple, same size? Which one has more sugar?
Potato.
White potato, so highly packed in sugar, you can't taste it. It's so jammed up. Pasta, it's all glucose.
Starch in the potato.
Yeah, it's starch, which is sugar. So when they say no added sugar, and they list the carbohydrates on it as super high, they're lying to you. Because carbohydrates are a bunch of glucoses put together, and your body breaks them down, and you got all those millions of pieces of sugar flying around your body. People don't realize that chocolate is a fruit, right? It's a bean. Coffee's a fruit. Zucchini's a fruit. Everybody knows tomatoes are a fruit. Beans are fruits. They grow on a vine. They have seeds in them. So a lot of fruits are good for you. And I like, so that's why I like the fruits. If you want to eat protein, have an avocado or a fish. But I would only do fish once a week. Coconut oil, olive oil, these are all good. And avocado oil, of course. Seeds are good. So not peanuts or cashews. I know everybody likes those. But they're beans, and they're bad food combining. They're proteins and carbs in very high amounts in there, which is why you get gas when you eat beans, right? It blows your intestines out. And peanuts, cashews are not proper food combining, and they happen to have a lot of lectins in them, which are natural pesticides. And those lectins can, they're poisons basically, only in large amounts. But if you eat walnuts, pistachios, tree nuts, yeah, they're all good for you. So people always think they have a disease because their DNA's, if it's in the family. And if you know functional medicine, they don't believe that at all. So we're born perfect. DNA is on fire, working just like it's supposed to be. And there's a lot of DNA that's not supposed to be working, and it's not. So you don't have cancer, because when it starts firing, you could have cancer. So DNA works perfectly. It's a well-oiled machine. And it's got 4 codes to it, 2 purines, 2 pyrimidines. And it literally works like a quantum computer. So when you have a computer and it's zeros and ones, that's only 2. We have 4. So it's reading this DNA day in, day out, fixing 10 to the 79th processes in your body every single day. That's almost as many stars in the universe, right? It's 10 to the 90 stars in the universe. So that's an enormous process going today, and it goes through perfection from the day you're born. So how do we mess it up? Processed foods, chemicals, heavy metals we'll get into in a minute. Lots of stuff will mess it up, and it'll either turn DNA on that wasn't supposed to be on, or turn it off. And yeah, your DNA may be more susceptible to certain foods than other people's DNA, but eventually it's going to have a problem. So if you just stick to a clean diet, water with lemon in it, forget the sodas with stevia. So not stevia, what's the other one? Splenda. Splenda and the other ones, the yellow packet and the pink packets, those will shut your DNA off. Yeah, sweet and low will shut your DNA off. And they found that about a year ago in there. So what's better, a Coca-Cola with Splenda, like diet-free, or a sugar cola? Which one's better for you?
A sugar. 'Cause your
Sugar.
body takes long to get
Yeah,
rid of
sugar is way better for you, and neither one's good. But if you're going to have the Coke, drink the sugar one. And do not drink the other one. It's pretty toxic. Foods to avoid.
I'm fast.
Fast food. Try not to eat. So what's wrong with milk and cheese? Well, it's caseins in it. It's a protein. Protein is very destructive to the joints. So, a lot of people, if they just put cream in their coffee, their sinuses are going to explode within 30 seconds to a minute sometimes. So it also has a very allergenic response to milk products. So casein is a very inflammatory protein, just like a lot of proteins in meat and cheeses and milks are. So the longest living people in the world are Seventh-day Adventists. Why? Because they're vegetarians. They don't eat this stuff. Right. So if they eat 10% of their diet in fish, and other things, because some of them do, then it's still going to be pretty healthy. They're not. But the vegetarians are the best ones if you eat it right. So if you're just vegetarian, eat pasta every day, you're going to be in trouble. So eggs, they can be good and they cannot be good. So I like a smoothie in the morning instead of eggs. Big 26-ounce smoothie, half fruit, half vegetable. Better than eggs. If you have eggs every day, you're going to develop an allergy to it, and you won't know you have it. Shellfish, honey, sugar, unless it's agave honey, that's low glycemic. Take out the artificial sweeteners. Alcohol. So alcohol is people always thought 2 glasses of wine a day was healthy for you. Not anymore. Very toxic. So how much alcohol is good for you? They say, well, none of it really, but 2 glasses a week is optimum. So I know. Sorry for the bad news. So fruit juices, not so good. Too much sugar, right? Takes
what would you drink instead of coffee, which I can't live without coffee?
Oh, so coffee, 1 cup's not so bad. It's a fruit, so I don't have a problem with coffee having 1 cup a day. 2 cups, if you space it out, but more than that's probably not good for you. But 2 cups is not going to harm you, right? If you space them out, you'll be fine with it. So it's when the caffeine gets a little high, you just tend to drain out your adrenal glands. So you're taking a multivitamin. That has maybe 20 ingredients in it, 25, right? This is what's in an apple. Anybody want to start to name all those things? See all those things? It's 500 chemicals in there, and you use them all, okay? Now, if this was a non-organic apple, you would have to add 23 pesticides on that apple. All at once is on 1 apple. Yeah, so an organic, no pesticides, but non-organic, 23.
Yeah.
In fact, they used to take a bunch of apples that are non-organic and they squeeze them and they pull out the pesticides, and they had so much pesticide they could spray the same amount of apples again. But that's what's going on when you eat them. It's not in the skin, it's in everything. It's in the meat too. So beware, all organic, you're worth it. Here's what's in a carrot. So you guys taking your 25 vitamins, well, this is what a vegetable will do for you. So you're taking beta carotene as one of your 25 things in your vitamin, but look at all the other stuff that's in there, right? However, lately with the farming techniques and so forth, we have problems with heavy metals in them. So we'll go through that one. So again, you're taking your 25 vitamins, and I bet you any money if yours will say vitamin C, ascorbic acid. Thinking, oh yeah, I got big loads of ascorbic acid. But ascorbic acid is an acid. It's not vitamin C. Ascorbic acid is one part of vitamin C. Then you got ascorbigen, you got bioflavonoids, rutin, tyranosinase, organic copper, that's an enzyme copper, P factors, J factors, K factors, that is vitamin C. All right, so if you're lacking these things, which everybody is, then your ascorbic acid is running around your body, burning up your arteries, and now you got heart disease. So if you Google it, ascorbic acid, does it cause heart disease? You'll see tons of studies showing it causes heart disease. So, but you know, some of you have all the stuff in there, so you can convert it to real ascorbic acid, which helps your body out. So how do you take real vitamin C without just ascorbic acid? It's called whole food vitamin. So that's why you want to take whole food. They're made from food. They put real food in there that's high in the vitamins. If you want to eat a meal, a salad's this big. It's going to take you half an hour to get through it. But that's what a really healthy meal is. And so when we talk to people, if they're approaching age 60 or beyond, then your diet should drastically change to smoothies, half vegetable, half fruit, salads, and high quality soups. Everything you make yourself, so it's not got chemicals in it.
Where do you get the smoothies? You make them yourself?
Yeah, I got a high-speed blender, like a Vitamix or a Bullet. You put a cucumber and papaya in there, raspberries and squash, but then add oil to your smoothies, like avocado, like a half an avocado to your smoothie, because you can't absorb everything unless you have oil in it.
Olive oil, that's not pretty good.
Olive oil is fine too. Sometimes when I run out of avocados, I'll just put a little half teaspoon of olive oil in my smoothie. So, and then you can absorb everything. These are all anti-inflammatory things to eat, right? So water with lemon in it is good. So, and then you got salad dressing, which is just natural, Dijon mustard, lemon juice, olive oil. And then if you want to eat meat, the turkey rolls are fine and low fat, but they have avocados with it, lots of fruits and vegetables. So what puts us in disease mode? Processed foods do that. Chemicals, sugar, carbs, like crazy it puts you in. So, as again, once you reach age 50 to mostly 60, you eat a McDonald's burger or a pizza, you'll feel it the next day in your joints, the very next day. And you go, why am I so achy? Well, that's because of the processed food. They'll happen that fast. If you have leaky gut and you eat a chicken or a steak or even fish, you'll feel sore the next day because those little chunks of protein went right through into your bloodstream to your joints, and the body attacks it like a heart transplant. That's why I like vegetarians, because they don't have that problem. So, and also vegetarians fix leaky gut. So people get sick from heavy metals, cadmium, mercury, lead. It's in all the foods nowadays. We're going to go through cadmium in a minute. Parasites. So amoebas, protozoas, worms, bad bacteria, viruses, and more. So if you look around the room, 1 out of 4 of you has worms in you. You don't even know it. So, and 90% of you have amoebas and protozoas and other parasites in you, and you don't even know it. So where are they found? Meat, fish. So not so much in fruit and vegetables. You can, but and then they build. So once decades later, after eating all this stuff, they build. They don't go away. They just build. I had a patient come in 2 weeks ago and showed me a picture of her daughter who went to the bathroom and there's a little worm sitting in there. A fluke. It's a liver fluke. A little flat worm came out of her. Oh my goodness. She had pets, that's why. So if you have pets, you might have parasites too.
How do you get rid of those?
That's our job. So yeah, we have a whole system set up. I used to use Paramax, but they don't make it anymore, which was a simple one. Now it's a lot more complex. So I couldn't really describe it right now. It's kind of long and lengthy. But when I did a parasite cleanse, that's one other reason why my health rocketed up. Because I was full of parasites. My parasite cleanse was Paramax only. My tongue turned bright green, fluorescent green, like for a month, right? And for a month, it sat there, and my kids go, ew, what's wrong with your tongue? And it was all bright green, and I couldn't figure out. So I called the company. They go, oh, it's just dead parasites coming out. I go, what? And but I felt great afterwards. No brain fog. My joints were better, and plus I was eating better. So I tried it again. I do it every year, and do parasite cleanse, and never turned green again. So I just had a lifetime built up. So your parasite cleanse is one of the greatest things you can do. Saturated and trans fats, so no margarines. So everything in moderation, make it organic, right? So if you want to eat chicken, beef, make sure it's 10%, 20% of your diet at the most. No inorganic foods, 23 pesticides on an apple, for example. So make sure it's organic because this causes disease. Improper food combining, we talked about that. Alcohol, medications, drugs of any kind, even Advil. You know, how many people die of Advil a year? Anybody know?
No.
About 30,000. Advil. And this is only in the first 2 weeks when they take it. They die. It creates, and that's the problem with all pills, any medication. It eats a hole in your gut and you bleed out. Cadmium is found everywhere. And it's in the air, it's in the farms, and if it enters your body, that's just an example of heavy metals. So it causes Alzheimer's, diabetes, depression, autoimmune disorders, and a lot more. So now you got parasites and you got heavy metals in you. So no wonder, people get depression. They get Alzheimer's, dementia. They say it was aluminum, but it's really all heavy metals cause it. But it's not just that, it's a lot of reasons why people get Alzheimer's, dementia. But if you clean yourself out of all toxins and heavy metals and parasites and eat properly, it fixes pretty much all of them. And then we have to get more specific after that to fix the rest of the body, but that's how we do it. So cadmium, they found lots of studies. This is a good study, a real study, that it causes diabetes and obesity. And so in mice, but it does it in people too. So cadmium causes oxidative stress. And so your oxidative stress is rusting. Your body rusts faster. And so if it rusts fast, and it also causes inflammation, and these all feed off each other. So therefore, if you have oxidative stress, how is it causing diabetes? Well, your mitochondria in your cells is where sugar goes to. So when you're diabetic, you can't get sugar into your cells, into your mitochondria to make ATP or energy. So cadmium makes this mitochondria, where all your energy comes from in your body. When you wake up, you got lots of energy just because of mitochondria. And that energy in the mitochondria, if it's already under stress by cadmium, the mitochondria goes, oh, sugar is just killing me now because I'm already inflamed, and sugar makes me more inflamed, and the sugar makes me more oxidative, and the oxygen makes it worse. So I'm going to shut down insulin so I don't get any more sugar in here because I got too much cadmium in here already. So how do the doctors fix it? They'll add metformin to you, and now you get the sugar in there, but it's just killing your cells. It's just wearing them out. So the better way to go is to get rid of heavy metals that are sitting there. It makes you oxidative stress. So ATP is your energy molecule. How do you increase energy? Like people get up in the morning, oh, I got no energy, because they have no ATP. So how do you increase it? Anybody know?
Yes.
Coffee, no, but that's different. Exercise. Yeah, you just some aerobic exercise. Lift weights, it'll increase ATP. So if you wonder why you're not able to get a lot of energy in the morning, it's because you're not exercising. So if you exercise and you start running up and down your driveway to start with, and then you're running a little bit up the street and up and down your driveway, and then you run about a quarter mile up and back, and then a half a mile back, and about after a week or two later, you'll have a ton more energy because you got that ATP in there. And that ATP lasts for days. So about 2 weeks goes by and you stop exercising. After 2 weeks, it goes back down. But it's there the very next day after you exercise. It'll be there for another 3 or 4 days. Well, 3 weeks, really. But it'll be in high proportion when you exercise. So that's why you go longer and longer and longer when you exercise. And then you go, wow, I'm running a mile. I mean, I run 2-3 miles, 4 times a week. And, but I stopped running a few years ago because I bike rode a lot. So I started running, and I could only get like a quarter mile in. I mean, I could ride a bike a long way, but running is a different sport. But now I'm up to about 2-3 miles, and no problem. I feel like I can do it all day because your body gets used to it, and then you have more energy. So if you do the functional medical program, you'll be able to do it, no problem, because we get rid of heavy metals. Heavy metals can cause increase of the bad fats in your gut and everything else, and these destroy your joints. That's just one mechanism for joint destruction. So you have a lot of, so what happens is when you have your adipose tissue increased in your gut, it sends out all the bad hormones. And everything gets inflamed, and any stem cells you have left in your body, stem cells we'll go into in a minute, they're not very many, not after about age 30, 20. There's hardly any left in your body. But any that are left there, which repairs your body, are now too busy fighting your inflammation up to fix your joints, so the joints go downhill. So there's a direct link to diet and your joints. I mean, direct. That's why the very next day after eating a pizza, you're going to be stiff. It'll go to work right away. So you want to fix your body faster than it breaks down. And if you're achy all over the place, it's because you're breaking down faster than you're repairing. So, and stress for the body is if the body will go into stress, chemical stress, mental stress, physical stress, all from if you don't exercise, don't do sunlight, garbagey food, you don't meditate, progress. So I'll just reverse this. So if you want to have less stress in your body so it functions a whole lot better, you exercise. You have 20 minutes of sunlight. 20 minutes of sunlight a day reduces cancer, including skin cancer. 20 minutes, not longer, because it increases your vitamin D, which is anti-cancer. Garbage foods, we already talked about that. Meditation, great. It puts you into theta waves, and those theta waves can heal. So meditation theta waves works on a quantum level. So do stem cells, so do exosomes. And this is important because your body is made of cells, which is made of atoms. And those atoms are not solid, they're in wave form. So a waveform that's put into solid form through consciousness. I mean, every physicist has done multiple studies to show this, right? The double slit experiment, for example, and all those. So, but your cells, when you're in meditation or asleep, turn back into waveform, and because consciousness is somewhere else, and you can repair whatever sickness you have through meditation by repairing the quantum level of your atoms. Dr. Joe Dispenza does this. You know Joe Dispenza. They do this. Joe Dispenza is a master. He's a chiropractor. He's one of the top meditators in our country. You go to 7-day retreat. People are walking out with cured from cancer, cured from all diseases. In fact, if one lady had her thyroid removed because of cancer and went to a seminar and went back, and the doctor was astounded because the thyroid was there again and it was perfectly normal. So, Joe Dispenza. Dr. Joe, great day, 7-day retreat. He's coming here in August for the first time ever. It's hard to get a seminar. There's thousands of people go, but it's sold out in a day. So, but he explains it really well on a quantum level. And then you do it, and you go off into this quantum level and get what you want in life, your health. Procrastination, that's a big one, because I go, I'll exercise tomorrow. I'll eat properly tomorrow. I'll have my pizza today. So it's a big one. And it makes you feel shameful and all those other bad negative thoughts. Poor sleep habits, of course, that's a huge one, poor sleep habits. Because the best time to go to sleep is 10. That's where you get the best sleep. If you have sleep problems, because you're not going to bed at between 10 and 11. You're going to bed, there's a huge, gigantic government study done with the Army. If you go to sleep after midnight, you can have problems sleeping sometimes. So, or you wake up tired. So 10 to 11 is the best time. 10 to 12 if you push it. But that's the best time to sleep for 8 hours. Having hobbies helps, keeps you on purpose, right? Especially if you're retired, you want to have a purpose because you die when you retire if you don't have purpose. I mean, so many studies have shown that one. Stay off social media, especially the blue lights. Blue light is TV, blue light of your phone, blue light of computers. They have those in Vegas. They have the blue lights everywhere because it releases endorphins into your brain and you're just stuck on it now. It's an addiction. So, and they've done tons of Google invented the blue screens and stuff after that to try and get you hooked onto watching computer screens so much. So that's social media bad. And then you add social media, you got a real addiction. Management of time, which goes along with procrastination, and disconnected from yourself, meaning you're not authentic. Anyone who has an addiction is not authentic. So, and the only way to get rid of addiction is to raise your frequency to hear. So when you're born, you're at top frequency of your body, God level, quantum level, universe level, whatever you want to call it, right? And then crap happens to you in life, right? You get hurt, you get injured by somebody, just crap happens, your frequency goes down. When it goes down enough, you have enough pain, that's where addiction starts. They send you to rehab, what are the odds of fixing you in rehab? Anybody know what the odds are? 1%. 1%, 50 grand, everybody gets there, 99% will not be cured. So it's because their frequency's still down here. You got to raise the frequency up to full. highest level possible after you were born. So there's different ways of doing that. So just when I do functional medicine, I will do addiction if they have an addiction issue. Maybe it's just having 2 glasses of wine a night, but they want to get off of it, so I'll go through that. So it could be just sugar. Whatever it is, it's something that's resolving their pain, because addiction is pain. So that we go through all that stuff too. So exercise does your body, mind, spirit good. It detoxifies you. It exercises the arteries and builds ATP molecules, energy molecules. Reduces tiredness, low energy, and depression. You want to get rid of depression, exercise. Fix your gut and get out of the habit of being in depression, because a lot of times depression is a habit. You're just used to it. So it helps your joint, heart, and all organs. Pretty much helps your whole body, exercise. So diet and exercise is how real medicine should be. If you're over 80 and you run, the odds are you're not taking any medications because you're healthy. So there's people who are over 80 running. I mean, I still run. I'm 65, but hopefully be running at 80 too. And but they find that they're exercising. They don't have to be running, but this is a study about running. They could do any exercise, and they're doing it pretty good. Running a couple miles, biking maybe 3 or 4 miles a day. They don't take medications. Your whole body heals itself if you're exercising. So it makes you younger. So instead of plastic surgery, you just exercise. So how do you get there? How do you get to the health you want to do? Because, some of you have joint pain and you can't run, you can't exercise. So that's where chiropractic physical therapy comes in, to get those joints moving again. So when we adjust a joint, the cartilage grows back in there and you can start to function more and more and more. And then, of course, the functional medicine, which is the diet changes. So it's a lot to know with diet. Like people always ask me, should I take this vitamin, should I take that one? So if they join a program, we will test them and determine exactly which way they need to go with our team. And you're more apt to do it. Like when you leave here today and you don't do any functional medicine, you go, that was really good. I'm going to learn, I'm going to do all this stuff, and next week somebody brings over a pizza or something and you're eating it, and then it doesn't go away. So we stay on you for a year and coach you and make sure that everything's in good shape. And then they do it with me and our team, which is MDs, PhDs, all that stuff. So, and these MDs, they're not practicing. They study the nutritional components. So it's pretty rare to find those, because most of them are all about drugs. And we're not totally against drugs, but as we said, but we want to try and eliminate the ones you don't need, which is most of them. Eliminate heavy metals, eliminate toxins. And as soon as you eliminate toxins, get the liver healthy, your weight comes off like crazy. Eliminate parasites, because it causes all kinds of problems. How many of you have been tested for parasites by your MD? No one, right? Why? How many of you have been tested for toxins or heavy metals? No one. That's real health here. So they only run their set of tests that are run by insurance companies. We have thousands and thousands more tests. I mean, these tests, if you got them all, it'd be $120,000 to get all these tests. So, but we get them for 10 cents and $1 because we don't go through the insurance on these tests. So most tests are around $150 for a whole list of different things that they won't test you for. Some of them they will. But my team comes in and analyzes these. And they will pick it apart and see things that are like, whoa, I didn't see that. So I would see sometimes, and sometimes I correct them on things, but they're amazing. So we had a patient come in, treating for diabetes, but she has other issues. And she'll eat a couple blueberries and her sugar will spike. So, and she has low energy. So what the heck's going on? So the doctor says, put you on metformin. It came from eating meat, the diabetes, by the way. She was vegetarian, didn't have diabetes. They put her on a carnivore diet. Somebody told her to do it, so she did, and became diabetic. Go figure that one out. So it's supposed to help you with diabetes, but she got it from diabetes. So what happened? Well, this is the complicated part that we had to figure out. Why would meat cause diabetes? It's supposed to be a cure for it. And what happened was the meat created inflammation, made her body so inflamed that it threw off her thyroid. And the thyroid was spiking and going down, and that created diabetes and a sugar issue. So, she pretty much has full-blown thyroid that doesn't show up on a blood test very well. If you catch it at the right time, it will. So why doesn't it show up? Because the inflammation covers it up. Who would have ever, your doctor would never have figured that out, but these biochemists figured it out. They're part of the group. So they went in and said, so they warned her. They said, we're going to get rid of your inflammation first. Your thyroid is going to start to fail when we do that, because that's the true thyroid you have right now. Your body's eating it up. So we're getting rid of her inflammation, preparing her for the thyroid issue, and then we're going to prepare and fix the thyroid issue. But we have to do it in steps. So, because she's just, I mean, she has no life. She can't get out of bed. She's tired, and she can't eat anything because it turns into instant sugar in the bloodstream and knocks her off. So we have to do something. So that's how we're approaching it. The metformin wouldn't have fixed it. So, and we may need some kind of thyroid medication down the road, but at least we got rid of the inflammation, and we've tried everything else, and now we know of a cure for it, which, if we had to, thyroid medication. But that's where we come into it. But they would have put on metformin for diabetes, not thyroid medication, because it doesn't show up. But it does show up if you run the right test, which they're not running. And we ran the right test to show it. So that's the kind of thing that we do, and it's a lot of time spent. So we do lab tests, naturopaths, we have MDs, DC, we have a whole team of us that fixes you and stuff. So there's too much for a person to know. I mean, even me, I know this much. Medicine knows this much over here of medicine and stuff, diagnosing, the great diagnosing. I know this much of, which overlaps theirs a little bit with diagnosing, x-rays, MRIs, lab tests. And then other people know this much, and other people know this much, PhDs know this much. So it goes on. It's wide as this room of information. So it takes a team to do it. So now we're going to learn about regenerative care, stem cells. So if you can't exercise because your joints are arthritic, or even autoimmune disorders and other things, and you're just not getting better, stem cells and exosomes come into play. They kind of boost you, and they give you a head start. So usually within 30 to 90 days, your joint's renewed with stem cells. So stem cells done all around the world. It's just this country, and I'll talk about why, that your doctor doesn't even know about them hardly. It's weird. They just don't know about them because the drug, FDA allows it. The drug companies don't want them to know about it because it has an enormous cure rate, right? In Canada, you have type 1 diabetes in Canada, right? There's a lot of evidence shows you put stem cells into the pancreas, and they regrow the islets of Langerhans and produce insulin again. And they had it since they're 8, now they're 40, and it's producing insulin. So here's a joint, a knee. There's a normal one, nice big fat cartilage in there. And then this one has a thin amount of cartilage. All doctors, your orthopedist will always say bone on bone, but it's not. It's just a scare tactic. As long as you can bend your knee 90 degrees, it's not bone on bone. Bone on bone means I can't turn it, I can't move it at all. So as long as there's cartilage in there, we can put stem cells in there and exosomes to rebuild that cartilage. Otherwise, they got to chop here, and put another. Yeah, that's what they do. And then people think, oh, I'll get a knee replaced, no big deal. But people don't realize I've had like 4 patients die from knee replacements because they got a clot in the back of the knee and it goes to their heart within a day or 2, and then they end up with an embolism or a heart attack. And it's hard. You can't stop it. You can't put on blood thinners because you just had surgery. So there's no way to stop that. It's very difficult. So a lot of lawsuits for that one. Surgery is not as simple as you think. Majority come out okay. They always have some kind of side effect, majority, but in the end, they come out okay. But there's a small portion that die or have serious consequences. I have another friend of mine who had a foot surgery, put metal clamps in there, and that attracts bacteria, and now his bone's been eaten away by him. And he's had it for 4 years, and they can't get rid of it. Bone infection, once you have that, it's pretty hard to get rid of that. So the antibiotics don't go there, so that's why. So there's a hip, nice big thick cartilage, and thin. So, that's arthritis. But there's hope, right? So we just have to, so we put stem cells in here, and they hunt down the inflammation, because when you have arthritis, you have inflammation. They hunt it down, they reproduce into millions and millions and millions of stem cells, and those things end up becoming whatever you want them to be. So in here, it would search out and say, I want to be cartilage, so they become cartilage. I want to become a tendon. They will hunt down the problem and fix it. How do they, anybody know how this happens? How they know what to fix? Yeah, no one knows.
Quantum physics.
Quantum physics. It's on a quantum level. Yeah, the same way as when you're born, if you remember when you were 2 cells, anybody remember that? Sperm and I teach the birds and the bees. Sperm and I get together, they make a cell, they duplicates, 4 cells, 8 cells, 16 cells. And then eventually it turns into an eyeball, an ear, an arm, a heart, liver, lung, right? It turns into all these things. How does it know to do this? You know, in the mother's womb, how does it know? Quantum physics, nobody knows. It's just, you know, one day we will, but right now we don't. Same level. So these things are like the little baby just starting. And they hunt down, we do know that they hunt down inflammation and they fix it. So then they just magically works. It's almost like too good to be true, but it is true. But that's because it works on this godlike level. Symptoms are important, so we listen to the body and what goes on, not just with the hips and knees and hips and all that, but it could be neck, back, it could be health problems, you know. So all these symptoms you have are something in your body screaming, something's wrong, fix it and don't ignore it. 5 dangerous words, maybe it'll go away. So you have to listen to yourself, you know, what's going on, and don't ignore it before it gets too late for us to fix. So, so basically you want to do something now about it, because you want to get, you know, especially if you're getting older and you want to retire and have a stress-free life and exercise, travel, do all that stuff. So all of a sudden you retire and you can't move. That's crazy. You worked your whole life. So it's best to get it done as soon as possible. And I'm talking the entire health or stem cell therapy or exosome therapy. Get it done as soon as possible to get yourself healthy, because then you know what to do for the rest of your life from day one without too much destruction. So you have options. Stem cells, what are they? So you have stem cells, you have exosomes. Stem cells are cells. Exosomes are tiny little vesicles, really hard to define because they're on a quantum level too. I mean, they're tiny. You know how small a cell is. Well, they're minuscule of a cell. They're just atoms. They're weird. Stem cells and exosomes come with cytokines. Cytokines cause the immune system to communicate, and it puts the killer T cells in there if you have cancer to kill it. So can they cause cancer? Tiny bit. Can they cure cancer? Way, way more. So let's say you have a little cancer and they pump cytokines in you. The odds are it's going to fix the cancer. So these are undifferentiated cells. Means there's no antigens on them, so you don't have rejection. So they have a couple little ones, but by the time your body figures it out, weeks later, it's already turned into your own body and your own antigens and your own cells. So they replicate so we put a few million into a knee joint, they replicate into millions and millions. And after they replicate, they become whatever you want them to be. So cartilage. And so when I tell people, so the reason why I like doing stem cells here, not the orthopedist office, because the orthopedist doesn't really do stem cells, they do PRP. So PRP is where they take stem cells of your own body out of your bone. So stem cells come from bone marrow or fat or umbilical cords, amniotic fluid. If it comes from an embryonic source, which do have antigens on them, by the way, so these can be a problem, but not if they're an umbilical cord. So these are illegal just because of the abortion stuff. So adult stem cells are pulled out of people. That's a bone one. That's incredibly painful, pull it out of your bone. Yeah. Another one pulled out of fat, also painful. And let's take a look. Are they any good?
No.
No. Because first of all, they're adult stem cells, so they're not like it was when they're in the placenta. Those ones become an eyeball, an ear, a nose, right? They become whatever you want them to become. These ones are pretty much already programmed. The DNA is programmed, so it doesn't work. Plus, by the time you're 30 or 40, you got so few in there, nothing happens. So, you know, by the time you're 50, you have 1 in 400,000 cells are stem cells, whereas before it was 1 out of 10,000 when you were born. So it rockets down, and then it gets worse after that. So they're going to pull out maybe a couple hundred if they're doing the bone or fat, but a couple hundred, and then they're already programmed, so they're not going to really become the tissue as well. So PRP, we were looking at doing PRP here a few years ago when we had doctors here, and had a 30% chance of success, which I thought, because it's cash, insurance doesn't cover it, but I thought was too low. So we never did it here, because 30%, 70% of people are going to be unhappy, so I don't want to put up with that. So we didn't do it. So we stopped it, and we didn't do it. Then comes stem cells. I didn't know that they were illegal. And, most people thought, which were brainwashed, that stem cells were illegal. And then I found out it wasn't, and people are starting to catch on now. The umbilical cord stem cells, and those are high potency, and they're huge, and that's what we use. It's called Wharton's jelly. It's in the umbilical cord, and it has all kinds of things, growth factors. These are cytokines. Cytokines are incredibly complicated things in your body that make all the immune systems work. So when you have cancer every day, the cytokines are at work to kill it off with the killer T cells and white blood cells. They have their communication. And I'm a biochemist. To understand the communication going on in the body will blow your mind. Like, again, how are they communicating like this? And that's it's called a redox molecule. We talked about it, but it's really a quantum level stuff again. So hyaluronic acid is cartilage, basically, growth factors. Mesenchymal cells are the ones that are found in here, not the adult stem cells that the orthopedist use. They're much more powerful. And it only takes one shot to do it. It doesn't take multiple shots. So where do they get them from? So if you're a woman and you have a cesarean and you haven't had COVID or a COVID vaccination, then you're a candidate to give up and they want to give it up. So how many people is that left? Not very many, right? Then they give up their umbilical cord and they take stem cells from there. And then the FDA tests it multiple times. They have 3 days to do all this, and they test it, make sure there's not infection and other things going on in there. And then they spin those down and they freeze them. And those are the stem cells within 3 days. So, and we use a company, Vitacell. It's all numbered, so you can trace it all the way back to the placenta. And so and we test it, so we know it's 99% active. So that's why we picked the company, because we tested it. It's all approved by FDA, structurally done, and it's starting to grow. A lot of people go to Mexico for it, right? Because they think they can't get it in the U.S. And because even your medical doctor doesn't know about it. A lot of them say, "Oh, don't get that. It'll cause cancer." No, what are you talking about? And they'll warn you. And orthopedists constantly go, "Oh, it's probably fake stuff." They say it to my patients all the time. "I want to do PRP on you. We never know it's real." But it's not. Their stuff is just adult stem cells, and it's a very tiny amount. This stuff is real, and we test it, and you can talk to the lab company, and the lab company has it all. The FDA checks the lab company constantly, so there is some good with the FDA, but and they find that to be positive. So we have to fight this all the time with doctors, but so that's why in Canada they do it like crazy, in Mexico and around the world, but the U.S. is just, they brainwashed everybody, so including me. I didn't know it was out there. So what conditions can they assist in treatment? Arthritis, of course, big one there. Grows cartilage, grows tendons, ligaments. Diabetes is good for that. Cancer, multiple sclerosis, autoimmune disorders, all kinds of stuff. A lot of athletes do these. So who are the athletes? You got this guy. Remember this guy? Who could name this guy?
Peyton Manning.
Yeah, Peyton Manning. Football, right.
Peyton Manning, anyway.
Tiger Woods. He gets it done. Arnold. Kobe. Dustin Hoffman. Not an athlete, but an actor. David Beckham. Stem cells. And these guys go to Mexico for some reason because they don't know it's here. But they're learning it's here. It's coming up pretty quickly. But Stallone does it. Yeah, you look so young still. All right, so I was at Tony Robbins' big seminar. 30,000 people. It's on Zoom, and you spend $100 million on this technology of TVs. And 30,000 people. He does this every 3 or 4 months. And it's a four-day seminar that goes from 9 in the morning till 2 in the morning. It's like nuts. And he's going through all this stuff. So on day 3, I remember, it wasn't even part of his seminar. He puts his arm up like this. He goes, "Wow, I just had stem cell done in Mexico. And I'm going to tell you that stem cell is the best thing you could ever do for your joint, because no doctor could fix my shoulder because he had giantism, right? Hormonal. Nothing could fix it." And he went on and on about stem cells for his shoulder. And then he goes back to his topic he's talking about. But he just broke off and talked about stem cells. So if anybody takes his stuff, he'll talk about it. If they take his seminars, you'll hear about stem cell. And he's just giving a piece about how he was fixed. So you have to imagine what it's going to be like. So the first step is to get rid of your pain so you can exercise, and it gives you motivation to eat right. And it just goes on and on from there. The stem cells are the ones you want to do first, and exosomes, to get your health right so that you can function. So you're not getting out of bed going, "Oh, my achy joints." and not being able to do anything. You got one life and this is it. So, I mean, at 48, 49, I was a mess, and 64 or 5, I'm better than I was back then. I mean, I played football last Tuesday with a bunch of guys, and I did fine. Stem cells, exosomes, and functional medicine, just make a decision at least to fix your health. And many of you will need coaching or the actual procedures, and they're so simple here, so we do them here. And it's really about coaching and learning and testing. And it's not hard. What we do takes a while, it takes a year for the functional medicine. And the stem cells is just one visit. And the nurse practitioner, we have a medical team that does it. So the nurse practitioner comes in, who's an anesthesiologist, nurse practitioner, so she knows where to put the injections. Being a chiropractor, we are experts about patients, so we can tell exactly where the problem is, better than an orthopedist can. So we're perfect candidates with a nurse practitioner to do it. And then you have exosomes. Exosomes are these weird little structures. They're not cells, but they are the communicators. They are tiny vesicles. They're released by cells, and they make openings in other cells so you can get proteins to come in. And they also allow messenger RNA to come in to make more proteins to help build your cell walls up. So this is the building blocks, and this is the machinery that builds it. So this builds it, and it needs these blocks. Now you have exosomes in your body, but by putting extra exosomes in the area means extra building blocks. They're like little vesicles, and they allow stuff to come into cells now, and you have messenger RNA that duplicates itself. And I'm just dumbfounded how complex the body is, and it works every single day. And then it also gets rid of waste, exosomes. They get rid of the waste products. They're pretty important for the body. So this is what it can heal. Exosomes did this. Somebody with diabetes, they lose their foot from these things, right? Very hard to fix medically, and they amputate all the time. This is exosomes after, I think it was like 2 to 3 weeks, and it's gone. This person who was burned, and 2 weeks of exosomes, and that's what he looks like. Wow. He sprayed it on his skin, so he's fine. I link up with the stem cell doc, who's done 7,000 stem cells. We do stars like Travis Pastrana, you may know him. In the younger world, everybody knows him because he's the #1 motocross guy. Jumps out of airplanes without parachutes. And then we got MMA fighters. We got a lot of MMA fighters, football athletes. This guy who won the Olympics, he's had stem cells that we did here at the office here a little while ago. He's in good shape. These guys are all healed from their injuries because they're a mess. I mean, 108 bones broken in Travis Pastrana from motocross riding. They fall off their bike and just surgery after surgery. So we stem cell doc is they're national. It's Dr. Fedorczyk, and he's done over 7,000 stem cells. So his team comes in and does them, and he picks the best company. He's researched it and all that, and he showed us the research. So we use him to come in and do stem cells with his team, a medical team. So that's who comes in and does it, and we pretty much have the best there. 6 reasons to get stem cells. They only work if you get them. Best chance of improvement is right now. Things get worse over time. So life is about happiness and living. The better you feel, the happier you'll be. So there is nothing more important than your health, not your car, not your house or anything. It's no longer necessary to be in pain and unhealthy. But I see people who are 60 and 70, they go, I guess I'm supposed to be in pain. But no, I'm 65, I'm not in pain. I have good health because I worked at it. So. And if you are in pain and unhealthy, it's all right. You can fix it. You can reverse it. I reversed mine, and I was in bad shape, worse than most of you. I don't really know how much some of you are, but I was in bad shape 18 years ago before I fixed myself. And then we have big savings because we forward the savings off to you because he buys in bulk the stem cells from Vitacell, and so he gets big discounts. We forward that off because they're expensive for us to buy. So we forward that off to you because most people get stem cells like 10 to 20,000 out there out west and other places. Here it's a fraction of that cost. So if you don't make time for your wellness, you'll be forced to make time for your illness.